Hello, everyone. Thank you so much for taking the time to join us for our very first virtual caregiver counseling session presented by our social work team here in the Windsor Regional Cancer Center. My name is Jenna Smith, and I'm the Quality Improvement and Patient Education Coordinator here in the Windsor Regional Cancer Center. And I have the pleasure of introducing today's guest speaker, Nancy Hannon, registered social worker, who will be walking us through today's session. Please take it away, Nancy.
Thank you, Jen. I appreciate that. Very nice intro. So yes, good evening, everyone. As Jenna mentioned, I'm a social worker here at the Cancer Center. Just a brief sort of intro. We have 5 social workers here available at the Cancer Center that offer support to both patients and their caregivers. So we're glad that you joined us this evening for the Someone You Care About Has Cancer. So I'm just going to go forward with the slides. And if you have any questions at all, don't hesitate just to put a question up, or you can certainly wait until the end and ask then. I'm going to turn off my camera just so that you can focus on the slides and the information. So our first slide is just an acknowledgement to the Ottawa Regional Cancer Center. So we worked really closely with Ottawa and their cancer center, and they were very generous in sharing the majority of this presentation. They use it, and we adapted most of the slides just to fit our cancer center and the Windsor-Essex area and the Lynn, all the Lynn area and the hospitals and that are, that we provide services to. So this presentation was adopted from the Someone You Care About Has Cancer, and the information, as I said, was developed by the Ottawa Regional Cancer Center at the Ottawa Hospital in our lovely capital of Canada. We would like to thank and acknowledge the Ottawa Hospital for generously sharing their valuable materials with us. So our land acknowledgement, we respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkodawan, and Anishwaabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Can't speak tonight, sorry. Privacy and consent for virtual hybrid care and in-person care. So you have the right, as someone participating in this presentation, you have the right to withhold or withdraw consent from participation in this class at any time. You have the right to privacy and confidentiality of your health information. Information about yourself and your treatment will not be shared outside of your circle of care without your informed consent, with a few exceptions. For example, if there's a court order or in the event that there is a threat of self-harm or harm to others. Despite the best efforts to ensure high encryption and secure technology on the part of the Windsor Regional Cancer Program, your information could be accessed by unauthorized persons. Services could be interrupted, distorted, or disrupted due to unforeseen technical problems. You can maximize your privacy by using your own private internet connection that is password protected, not public. You can have protection software like an antivirus on your computer. You can ensure that you're in a safe and quiet space, and you can ensure that only those you want to hear are present. So the privacy and consent for virtual, hybrid, and in-person care continued. For safety, we're working on your mental health may at times elicit increasing feelings of discomfort, anxiety, and or distress. For those who are participating virtually, you accept that you may not have access to in-person support from staff when participating in virtual care. Please inform your primary care provider if you have an increase in suicidal thoughts or engage in self-inflicted harm. And if you require immediate support, please contact the Hotel Dieu Grace Care Healthline at 519-973-4435. This is a 24/7 service, but just please note it is not an emergency service. While feelings of sadness and anxiety can be very normal during this time, we also encourage you to reach out to your primary care provider. Sorry about that. And if you have thoughts of self-harm or suicidal thoughts, please immediately call 911 or proceed to the nearest hospital emergency department for help. If there's anybody has any questions, please let me know. So just some general housekeeping rules when participating virtually. I just want to make sure that everyone can hear and see the presentation. If there is a problem, please let us know and Jenna will help us out. Please keep your microphone muted unless you're asking a question, just because it does help to minimize background noise. Please keep your video off to increase virtual call quality. Do not record this session. It will be, a copy of this will be sent to you at the end. So you will receive a copy of all the slides if there's anything that you wish to go back to and review. Or certainly I know that people may want to take a picture of an individual slide as I'm going through them. You can use the chat function in Teams to ask questions. And as I just mentioned, a copy of the slide deck will be emailed to each attendee following today's session. And we would appreciate it if you could complete the evaluation survey that will be provided to you following today's session. So any kind of feedback is very helpful for us. This is actually the first set of presentations that we're doing. So we're looking at trying to make sure that we're providing, the information that's valuable for you as a caregiver. And you may find that in certain sections, perhaps there's too much information or maybe not enough information. And there is towards the end, we do have quite a few slides with a lot of resources that are listed as well. So we take both types of feedback and look forward to the survey that you complete. So the goal for today's session is to review the impact of cancer on family members and caregivers, review the normal reactions when someone you know has cancer, define what is caregiving for someone with cancer, learn what you can do to support somebody with cancer, learn about ways to take care of yourself. Self-care is very important because if there is the possibility that caregivers can get burnt out. So we want to make sure that you as a caregiver are also taking care of yourself, so you're in a position to be able to take care of the individual that you care about and love. Get information on financial programs that are available, learn about community and online resources that are available, and review facts about life after cancer.